Good afternoon, distinguished judges and audience members. My name is Alisa Siripaopradit. I'm a fourth-year medical student at Chulalongkorn University, and today I have the privilege to presenting on behalf of our research team, Alisa Siripaopradit, Pakapon Sopon Sakunsuk, and our advisor, Dr. Sila Washatimanon, without whom this study would not have been possible. Our study is about exploring the impact of ChatGPT on medical education, a cross-sectional study among preclinical medical students in Thailand. I'm sure you've all heard of ChatGPT before. It's a generative AI, a type of large language model that has been trained to understand the natural human language and generate human-like responses to various prompts and questions. ChatGPT is revolutionizing web search. Why, you may ask? Because you can't ask Google to diagnose or tell you the answer to your exam questions. But ChatGPT can read your case and give you a diagnosis and treatment plan. And it's not making it up entirely either. Studies have found a 70% accuracy for medical diagnosis and medical examinations. That means it was right about 70% of the time, enough for it to get a passing grade in medical school. That's why we wanted to explore how preclinical medical students, who often struggle to bridge the gap between a layperson's understanding of the human body and the depth of knowledge expected of a physician, we wanted to know how these people were using ChatGPT and whether they found it beneficial for them. So we designed a survey to obtain data about ChatGPT usage and perceptions of ChatGPT among preclinical medical students. And then we narrowed it down to ask them specifically about how they used it in specific scenarios, such as in case discussions and for exam preparation. Our target population was first, second, and third year medical students during the 2023 academic year. And we aimed for 100 participants, and here is what we found. Most of our participants were third-year medical students with an equal distribution of male and female students. 51.1% of our participants said that they use ChatGPT mainly as an additional platform for data search. 24% of our participants use ChatGPT almost every day, and 19% said they used it more than 10 times a month. The most prevalent concerns about ChatGPT was about misinformation at around 80% of participants expressing their concerns about this, and 60% about outdated information. In case discussions, 44% of students use ChatGPT in more than 25% of their case discussion sessions, and they used it mainly for generating differential diagnoses and for explaining pathophysiology and treatment. 45% said they found it beneficial for this purpose. For exam preparation, 37% of students used it for more than half of their exams, and they used it mainly for information search and to provide an answer key and explanation to previous exam questions. 43 said they found it beneficial for this purpose. So ChatGPT's high usage rate reflects a growing demand for accessible AI-powered learning resources in medical education. While its efficiency meets many learning needs, key concerns need to be addressed, such as invalid data, which can stem from AI hallucinations, and outdated information due to limited training on recent guidelines and evidence. Despite these limitations, frequent users perceive ChatGPT positively as a supplementary resource for exam preparation and case discussions. Moving forward, our research has the following implications: integrating AI literacy into the medical curriculum, advocating for AI-enhanced learning, and exploring ChatGPT's long-term impact across diverse populations and with qualitative insights will be beneficial and allow us to make the most out of this new valuable tool. Thank you for your attention. I'd be happy to address any questions you have about the study.
Thank you so much for the presentation. It's very interesting topic. So you use the ChatGPT only or the other AI include this the question for the medical student?
For our survey was about mostly ChatGPT.
And
Because
after the student not use?
yes, because at the time that we were planning, ChatGPT was the main AI that was used
Okay.
and well known.
Okay, thank you.
Thanks. Another interesting talk. You've got one of the implications is AI literacy training. I assume that's for faculty as well as students.
Yes.
And maybe actually the students can do some of that for the faculty, some reverse teaching there. What recommendations do you have on how we should be including that AI literacy training in the curriculum and when?
I think it would be beneficial to have sessions where we would allow students and faculty members to sort of use ChatGPT in specific contexts, such as case discussions, and to try and do exams alongside them, and then for them to look at the results and maybe figure out if the results are actually accurate and what they can use ChatGPT for. So sort of practical try it sessions.